The most important thing for children to understand about bedwetting is that they are not alone. As you can see from the chart, 50% of 6-year-olds still wet the bed each night, and even 2% of 15-year-olds continue to wet. Children always want to know, when am I going to be dry overnight? Every year, 15% of kids will become dry on their own without any intervention. We just do not know when that magical time will occur for each individual child. So it is our job to help children become dry before they do so on their own. Why does bedwetting happen? As you can see from the graph, there are many factors that contribute to nighttime wetting. The amount of urine that is made overnight by the kidneys may be more than the bladder can hold itself. The biggest reason has to do with the sleep cycle with children who wet overnight. These kids are sound sleepers who do not wake up to alarm clocks, thunderstorms, or smoke detectors. It makes sense that they wouldn't wake up to the sensation of a full bladder during the middle of the night. During an office visit for nighttime wetting, there is a lot of important information that we obtain, including family history of nighttime wetting, sleep pattern of your child, whether or not they are a heavy sleeper, whether or not there is snoring or sleep apnea associated with it. Even though your child may wet overnight, what occurs during the daytime can impact whether or not a child has a dry or wet night. A thorough daytime history is obtained. It is important for us to know how often your child urinates during the day. Do they even go at school? Or do they wait until the last minute to use the restroom? We additionally want to know if there is any wetting going on during the daytime, even if it's simple dampness. A bowel history is additionally asked. We ask the children how often are they having a bowel movement. Is there any signs of constipation, including large stools, painful to pass stools, or hard pebbly stools? We know that constipation can impact the amount of urine your bladder is able to store, and it is our goal for these kids to have a soft, daily bowel movement. A detailed history of your child's fluid intake is obtained. Specifically, what and when they are drinking. Many children consume a very small amount of fluid during the school day and tend to fluid overload when they get home from school. Additionally, we ask whether or not fluids are limited before bedtime. To begin getting ready for dry nights, it is important that daytime habits are perfect. This includes making sure that your child is urinating every 2 to 3 hours during the day, with or without an urge to go. We stress the importance of using the restroom at school. We ask that children double void prior to bed. For example, if they generally go to bed at 9 o'clock, we ask that they empty their bladder at 8 o'clock and then 9 o'clock, right before they crawl underneath the covers. We ask that bowel movements are monitored to ensure that they are having an easy-to-pass, soft, daily bowel movement. If this is not happening, we do recommend a stool softener. We discuss fluid modulation, meaning drinking more of the fluids earlier in the day, and then limiting fluids 2 hours before bedtime. Water is the best choice over juice, sports drinks, or soda. We encourage 1 glass of water with breakfast, 1 at lunch, and 1 after school. Once the daytime habits are mastered, treatment options for nighttime wetting fall under 2 categories: medication or a moisture sensing alarm. The moisture sensing alarm is a device that the child wears during sleep. This is an excellent option for children as it is curative. The moisture sensing device is attached to the underwear with an alarm that is fastened to their PJs. Once the child begins to urinate, the moisture sensor causes the alarm to activate. Eventually, over time, this mechanism conditions the child to wake up to the signal of a full bladder. There are several companies that manufacture bedwetting alarms. It is important to make sure that you purchase an alarm that does sound and does not simply vibrate. The second set of treatment options include medication. The first is DDAVP, or desmopressin. DDAVP is a synthetic hormone that is meant to concentrate the urine that is produced overnight, so your child can store a smaller volume of urine without having an accident. DDAVP works in about 50% of patients. It is important to understand that DDAVP is simply a band-aid to cover up the problem of nighttime wetting until the child outgrows it on their own. DDAVP does not need to be taken each night to be effective, and some children choose to use the medication for social situations, such as sleepovers or summer camps. It is ordered as a 0.2 milligram tablet with a maximum dose of 3 tablets before bed. It is initially trial and error to decide what dose keeps the child dry, whether it is simply 1 tablet or the maximum of 3. If DDAVP is effective for your child, every 3 months we do attempt to wean them off the medication to see if they are able to stay dry on their own. There are other alternative medications that can be prescribed if DDAVP alone does not keep a child dry overnight. Included in those are ditropan or Detrol, which help an overactive bladder or a child who has a reduced bladder capacity. At times, the combination of both DDAVP along with the ditropan or Detrol can keep a child dry overnight. The last category of medication is imipramine, which is a tricyclic antidepressant and is used cautiously. In summary, it is important for children to know that they are not alone in bedwetting. It is an extremely common problem, but one that most children do not want to discuss. We will do everything possible to help your child stay dry overnight.